All right, today we're going to do some medical imaging. We're going to talk about ultrasound, but before we start, again, I just want to remind you that I do not know why the quiz marks aren't coming up at all. I checked it for hours yesterday. I was on the phone today for an hour with the guy from the school board. Everything's clicked up properly. He went into it. He can't figure out what's wrong with it either. So hopefully the glitch in the program will fix itself out, or someone will figure out what's happening with it and it'll fix. But again, if you read the email or in the news, what I'll do is periodically through the day, I'll put your marks into EDSB so that you can see what each of your attempts is. Remember, you have 10 attempts, so if you get a crappy mark on the first one, just go reread your notes again and do it again. All right, so that's the first thing. The second thing is there's a handout for today, and then after today, what I'm going to do is tomorrow, I'll put it in today's work anyway, but all you're going to do is work on a sheet that's called Fun with Ultrasounds, which we're going to take up. All right, so do have an attempt with it, and we'll take that up on Thursday. So there won't be a quiz tomorrow, there'll be a quiz for today, but tomorrow will kind of be a little bit more of a relaxed day where you can get caught up on, you had 2 quizzes this week, so we'll get you, have a little bit of time to catch up. Okay, so what we're going to do is we'll talk about ultrasounds today. Now, ultrasounds are medically known as sonography, so sono here, all right, talking about using sound to make a graph or a picture. Okay, so we're going to be making a picture using sound. All right, now, basically what you're going to use ultrasounds for is anything that's in your belly or your abdomen. So your doctor will send you for an ultrasound a lot of times if there's something wrong down in your gut. All right, a lot of times if it's bones, you'll use x-rays. If it's gut stuff, they'll send you for ultrasounds. Not all the time, but basically that's kind of a good rule of thumb. So we're going to use it for a bunch of different things. What they'll look for if you ever go in for some heart tests, they'll do it for cardiology or look at blood circulation. If they're looking for tumors, so if you go in, you have a lump in your breast, or the doctor detects something in your prostate, they'll send you for an ultrasound first, because you can get a good idea of looking at the consistency of a mass by doing an ultrasound, all right? So they don't immediately rush you off to heavy-duty CAT scans. They send you for an ultrasound a lot of times first. Anybody who's basically, when you think about the word ultrasound, you think about pregnant moms going and getting pictures of their babies done. All right, so it can look at fetal growth or fetal sex. And again, anything that's in the pelvis, so all those solid organs, the liver, the kidney, the spleen, the pancreas, so they're looking at those kind of things. You can look at bowels and all that stuff as well. And then urinary tract. All right, so our cardiology and our blood circulation are looking at some tumors in the prostate or in the breast, fetal growth or fetal sex, anything in the abdomen, so those solid organs, kidney, liver, spleen, pancreas, and your urinary tract. Okay, so that's basically what they'll send you for. There's lots of other reasons as well, but that's kind of the major type. Okay. So what are the different types of ultrasounds? Now again, I'm going to give you 5 general types of ultrasounds. We're not going to get into all the details of all the fancy different ultrasounds, and there are more, all right? So just, these are the basic ones. But one of the first ones you'll go for is just the general ultrasounds that we're talking about. So where they'll put the probe on the outside of your body and they want to see what the organs are like on the inside, right? So that's just your general ultrasound. It doesn't really have a fancy name. I'm sure it does, but they just call it general ultrasound. Now you can have a transvaginal ultrasound. So they will put the ultrasound probe up inside you, and they'll use that for gynecological problems, or if they're looking at a very, very early pregnancy, right? The next one that they'll look up or use is a transrectal. So this is one that goes up your rectum. And what they're looking for there is if they're trying to do a prostate biopsy, so they need a probe in order to know where to do the biopsy from, or if they're looking at staging rectal cancer. Now the term staging, what they do with staging for cancers is they see what stage it's at. So it can be stage 1, stage 2, stage 3, stage 4. And how the staging, there's a couple things that go into staging, but one is they look at the size of the tumor and also where it's spread around the body. So this is one of the reasons they would use a transrectal one. All right, now another one that you may have is if you go in, you've had a lot of problems with your stomach, you think you might have an ulcer, or you've got a whole bunch of pain in your side. you know, they'll give you an endoscopic ultrasound. So this is going to look at stuff in your upper GI tract, see if there's any tumors or anything in there, or it can also extend down into your pancreas so they can take a peek there. Now, the last one we're going to talk about, just on this slide, and we'll probably never talk about again, is a transesophageal. So in the transesophageal, what they're doing is they're sending the probe down your esophagus to look at your heart and your aorta. And this is really nice because it cuts out, it's deep in there, so you're not going to get your ribs in the way of looking at the heart. You're going to get a picture right next close to the heart. All right, so that's a transesophageal ultrasound. All right, so basically ultrasounds, what are they? So what an ultrasound is it's basically using high frequency sound waves and echoes. This is a technology that was around during it only kind of came into effect after the Second World War, but they were using the technology long before that in the military field to look at, you know, looking at U-boats under the water. They were sending out sound waves and then they'd bounce back, and then they could get an idea of how deep the U-boats were and what their position was. So it's basically doing the exact same thing. So these two guys, Dusak and Donald, in 1942 and the 1950s were two big names in really developing these, right? Now, for all these who invented them things, just know the last names. I'm not interested if you know the years off the top of your head. It's just interesting to know that this technology was used for military purposes, and then it was only after World War II where they kind of went like, hey, we could use this for human purposes. All right, so, and just kind of know the names. Like, really the most important name is probably the Rowent engine guy, but anyway, it's just kind of cool to know these people. All right, so how does this thing work? So we've got a transducer. The transducer is a probe. For anyone who's ever had an ultrasound, or even if you use any ultrasound therapy, that's a little bit of a different thing, but it's still using sound waves. For an ultrasound, you're using sound waves, and the sound waves are produced by a crystal in the transducer, right? And it's a piezoelectric crystal that's in there, and once it's stimulated, it sends off an electrical charge, which is transferred into a sound charge or a sound wave. Anyway, so the transducer probe emits a sound wave. Okay, now you should have it on your handout. You have a picture that comes up and it's showing the a little bit of that information about this. So basically, the sound waves are going to go through the medium. So if it's through fat, through skin, it doesn't really go through bone very well. That it kind of bounces back really quickly off a bone, kind of goes straight through fluids. But the waves are going to bounce off the boundaries between the tissues. So if you were doing an ultrasound of the bladder, the sound waves would travel through the liquid in your bladder, bounce off the back side of the bladder, and then come back out to the transducer. Okay, so basically what happens is where we had for x-rays, either the energy was being absorbed by the material or passed through. What happens here is the sound waves are reflected, and they're reflected back, and they're picked up by the same transducer. So the transducer is sending the energy out, the sound energy out, and also picking up the echoes that are coming back. All right, and then again, so we could just jump through all the physics. What ends up happening is the machine or the computer that the transducer is connected to calculates the distance from the probe to the organ or the tissue. All right, so it's going to calculate out the distance here, and then what it's going to do with that distance is it's going to calculate it all out and form an image onto a screen. All right, so we've got sound waves, we're going to be measuring distance, and then we will be converting that into a picture. All right, and a lot of times the colors of an ultrasound are black, white, and grays. All right, but we'll have a little exception to that at the end. So basically, this is the diagram you should have. So the sender and the receiver, this is the transducer. It sends out the sound waves and also picks up the reflected waves coming back. And this is the distance in here, and that's what the computer will be calculating how far this is, so you can get an idea, a 3D idea of what's inside the body there. Alrighty. All right, and so I just use this picture because everyone's familiar with this. Again, there's a YouTube video for it. But, you know, of course, this is completely staged because normally it's not a bright room like that. You're in a, you know, they turn the light off a little bit to make it nice and dim. It's actually kind of nice getting an ultrasound. It's a little bit soothing. Okay, so basically what's happening here is the transducer here, and there's a pile of different types of transducers as well. So, I'm just showing you this picture here, but there's wider ones or skinnier ones. So you'll see a whole variety of transducers if you end up going into ultrasound technician or becoming a radiologist. So this is going to be emitting the sound waves. The harmful sound waves are going to bing, 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 bing through here, and it's going to bounce off different parts of the baby's body depending on the type of tissue. And so their sound waves are going to bounce back. All right, the information is going to go into the computer, and the computer is going to calculate and make the picture from that. Now, this says here non-harmful sound waves. I know quite a few years ago there was, oh my gosh, ultrasounds, because it uses sound waves, it causes your babies to have ear infections. And of course, you just have a kid who's got an ear infection, you're thinking, oh my God, it's because of an ultrasound. Absolutely, there's no link between ear infections and ultrasounds. They haven't found anything bad for babies using an ultrasound. Like, honestly, they really cannot find anything. You probably do more danger standing in a rock concert being pregnant than you would getting one ultrasound. Okay, so what are the benefits? So the benefits are, again, it's non-invasive. Remember, I said all these things are going to be non-invasive. It's fairly inexpensive, so it's like $100 or more depending on what you're getting ultrasound. And that includes, again, the cost for the technologist. The technologist has to get paid. You have to pay for the hydro, you have to pay for the equipment, you have to pay for the radiologist to read it, so it's fairly inexpensive. It's quick and painless. Now, I have that in question marks because if you've ever had to go and get an ultrasound on a full bladder, so if you ever have bladder issues or you go for a prenatal ultrasound, they make you drink a pile of water and then you have to just hold that bladder in there because they want it nice and full so it gives a better image. And when they're putting that probe in there, it's kind of painful, all right? But it's, again, nothing compared to doing surgery. Okay, again, you get fast results. One really good thing about it is there's absolutely no radiation. And then another really good benefit is a lot of times and I guess this is true for some of the x-rays as well, the machines are portable. So you can have portable x-ray machines and you can also have portable ultrasound machines. You always see those on, I'm going to say Grey's Anatomy, because they're like, somebody thinks they're pregnant and then they wheel in the portable ultrasound. So this is one of the good things about ultrasounds. Okay, but what are some of the drawbacks? Now all right, so what are some of the drawbacks of using an ultrasound? Well, sometimes the images are distorted, so they're not as nice and clear as you would expect them or that you would hope to be. It's not as clear as a X-ray. Okay, again, like I said, sometimes it really is uncomfortable for patients, so that they may be extremely uncomfortable. I remember my one friend, she's just a tiny little thing, and she drinks a ton of water before she went to one of her prenatal things, and then they told her to go and empty about half her bladder out and then come back, and she just said it was agony trying to stop that flow of pee halfway through, so she was really uncomfortable. And then again, for this one here, the quality of the images depends on the technician. The technicians are highly trained because they are the people who are moving the probe around, and where an MRI or a CAT scan, the computer does a lot of the work for you. It's kind of all pre-programmed in there. For an ultrasound, the technician really has to know what they're doing and be very careful with what they're doing to make sure they get a good quality image. All right, so let's look at some of the colors of ultrasounds, okay, or sonograms. So unlike in an X-ray, for an ultrasound, fluid comes back as black. So if it's a fluid-filled cyst or a bladder, or if you've got a big buildup of fluid on the knee or something like that, it's going to come back as being black colored. All right, tissue again comes up gray color depending on the thickness of the tissue, and in this particular case, bone, fat, and air all come up as being white. So bone, that's kind of nice. That's the same as our x-rays, but fat and air come up as white. All right, where air would come up as black in an x-ray, fat would come up as kind of grayish, but in ultrasound, they come up as being white. All right, so when you're getting an ultrasound, there's a different kind of ways that they do them. Now, if you turn to, I think it's the back of your handout there, you're going to see two pictures, one after the other, that talk about the orientation. Okay, so there's more than two ways to take an image, but we're just going to focus on these two ways for right now because they're basically what happens when you go get an ultrasound. So you go into ultrasound, it seems like the technician's moving that transducer all over the place, all right? But there is a real reason why they are moving it all over the place. So the first way we can do it is in the longitudinal or in the sagittal way. And if we're doing it longitudinal, I think I got this on your handout. I'm going to just put these all up. Yeah. So longitudinal, what they're doing is, okay, this person would be laying down and they're moving the transducer in this direction. So in the longitudinal or the sagittal direction, right? So up and down, it could be up and down here, up and down here, up and down here, wherever it is. And so when you're looking at the picture or you're looking at the sonogram, you're looking at the ultrasound picture, the left side of the picture shows structures towards the patient's head. All right, so you're looking at the picture and the left side of the picture shows the patient's head. All right, and we'll label those diagrams in a little bit. All right, so this is what this looks like, or actually we'll label them right now. So this is showing you on this picture here, just notice on yours as well, it says LONG for long, so that means longitudinal. All right, this is what they're looking at, longitudinal. This is a longitudinal one. So they had the person laying down and they were taking the probe from top to bottom, so from his head to well, not all the way down his whole body, but in that direction. All right, so this will be the uterus. Actually, it's a she. I shouldn't have said he. The uterus here, and then you see the bladder here. This is telling you it's post-void, so this person had to actually like pee out all their pee in there. All right, so this is the longitudinal. So if you're looking at the longitudinal, this is really hard to kind of explain here in 2D. With the ultrasound images, I have a hard time getting my mind to think in 3D while looking at a 2D picture for ultrasounds. Like I really kind of struggle with this. I really have to think about it. So God bless those people who can read ultrasounds really easily. I think you're amazing. All right, so this is going to be the head. So the person was laying in this direction when they were getting this ultrasound done. All right, so they were laying in this direction, and what you're looking at in this direction is deep down into where their bladder is. So you're looking down through their body into the bladder, all right, while they're laying in this direction. So obviously their feet are on here. Now make sure you know these. Longitudinal, head is on one side, feet are on the other side, because I always ask this. I always say, label on the diagram where the head and the feet are. All the time, all the time, all the time. People always get it wrong anyway, even though I tell you this is going to be a question. Okay, so that's the longitudinal way. Now, the other way that we can take an image, or that we're going to talk about taking an image, is in the transverse or the axial direction. Now this one is going to be your second diagram there. Sorry, this little part of the word there. The left side of the picture shows structures on the patient's right side. All right, so we're going to be taking pictures in this direction. So back and forth, like in this direction. All right, I put those diagrams on so it'll give you a little bit if you can kind of think. So what you're doing is you're looking at the picture through the top, but in this side-to-side direction. Now the other thing that's really important is the top of the picture is the place where is the skin where the transducer is placed. So you're kind of looking down into their body, but you're looking at the picture from the side, if that makes any sense whatsoever. Okay, so this is the transverse direction here. So over here, this is the skin that's up here. So you can see the layers of skin and fat up here. So the probe is shooting down the energy waves here, and we're seeing a slice. We're looking sideways at the slice that the probe is making from the top. Okay, on here again is showing you transverse. All right, so there's the trans to show you transverse. All right, so it's going to be some alliteration of transverse. You'll either see longitudinal or transverse on the slides. Okay, and here's the patient's left side, and here's the patient's right side. Okay, so again, you just have to make sure your orientation. Just imagine the person's laying there, and the transducer is going sideways over them in this particular case. Okay, so they can take measurements. So when you're getting an ultrasound, you're going to hear click, 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 click. And what the technician is doing is they're putting measurements from one side of an organ to the other side of an organ. So for example, if you're going in to get your aorta looked at, they're going to measure from one side of the aorta to the other side of the aorta to see if there's any swelling in there. Excuse me. So the length is going to be measured on the longitudinal image from left to right. Now, it really doesn't matter if you go right to left, but a lot of things that you should do in medicine is always kind of follow the same pattern so you don't miss anything. So the length is measured on the longitudinal image from left to right. All right, and the height is also measured on the longitudinal image from the top to the bottom. Right, so you're going left to right, top to bottom to get the length and the height. And then what you're doing is on the width, for the width, you're taking it in the transverse direction from left to right. Okay, so we're going left to right, and then for the height, we're going top to bottom. Okay. All right, so if we're taking a peek at this one, do I have this? No, I didn't put this picture on for you guys. Sorry about that. Oh, doggone it. I thought I had meant to. Anyway, this is just a little example of how to do it. Actually, you know what? I haven't even made this sheet up yet, so I can still do that for you. All right, so this is going to be an image that's going to be on your page. I think I'll put it on the first page. It's going to be on the first page. So I can squeeze those two things up. It's going to be on the first page. Okay. So we're going to take a peek at this. This is a transverse image, all right? So it's transverse here. So I said you're going to see some type of short form for transverse. Now assume that the date is up here. I think the patient name was up there at top, all right? So the information is on there for the person, all right? And we also have a, keep this in mind because this is going to be really important for fun with ultrasounds. Here is the scale on this side, all right? So take a peek at the scale on this side as well. Alrighty, so we're going to measure, this is the transverse, we want to measure this little thing here. So we're going to measure the width from left to right, okay, and we're going to be measuring that using this scale. Now I'm not sure exactly what scale this is, and I'm going to say millimeters, so this would probably be, I can't measure it exactly, but maybe 1, 2, 3, 4, 5 millimeters wide. Alright, so our width is 5 millimeters wide. So now let's take this, oh, doggone it. Oh yeah, longitudinal image here is the same thing. Longitudinal here, okay. So we're going to be measuring the length from left to right on this thing here. So this is going to give our length now because we're looking at the different image. And then this is going to be our height here. All right, and then again, it looks like it's, I would say 5 by 5 by 5. So it's, what does that equal? Oh, whatever, 125 millimeters squared. All right, so that's probably what that's going to end up being, the volume of this little blob, whatever it is. Okay, maybe it's a little growth that's in the liver or something. All right, so that's going to give you your measurements. So when you get to fun with ultrasounds, you're going to be doing this, you're going to be measuring the length, the width, and the height, and you're going to use the scale that's on the side that I have made sure that I've given you a scale that's proper. Okay? All right, so a few years ago, my sister-in-law sent this ultrasound image to me, and I was like, ha ha, you're so funny. Anyway, if you look at it here, you'll see why I said this. Now, some people in class, I always say some people can't answer this, and then I let other people try to figure out what it is. Okay, so the reason I said ha ha ha, it's so funny, is if you look at the date here, okay, so if you look at the date, it says 010416. Now, some of you may think it's the 4th of January, but it's actually the 1st of April. So I thought my sister-in-law, so Christina Ann Peterson, I went back and checked it again because I wanted to make sure I knew what I was talking about. She was at the ultrasound clinic that's in Windsor, and I was like, oh, you're so funny sending me this April Fool's joke, because when I looked at that, you can see it says A, B, and C. So I thought she was just goofing around sending me this picture that she was pregnant with triplets. So I went back and I was double checking, and it says 8 weeks or 8 weeks, 6 days. This is the estimated size. And I was like, oh, you're so funny. And I thought the ultrasound clinic gave people pictures to send to their relatives as an April Fool's joke. But no, this is really them. So this was them last year. Anyway, they were real babies in there. Anyway. So one of the last things we're going to talk about now is an echocardiogram. So if you ever get sent for an echocardiogram, what an echocardiogram is basically an ultrasound of the heart. So a lot of times they'll want to, if you're going in for surgery or chemotherapy or just general health, sometimes they'll send you in for an echocardiogram just to see how healthy your heart is, all right? So it's basically used to help you see different things. So you want to see how big, or like the chamber size. You want to see if all the chambers are within a certain range of correct size, right? Because you don't want one chamber to be way out of whack with where it should be, because that's a problem. You want to just be able to see how the heart is functioning, to see if it's just, you know, smoothly beating, not jiggling and doing all sorts of stuff. You want to see the function of the valves, how nice the valves are working, and in what shape the valves are in, like if they're not closing properly or flapping open or whatever it is. And it also gives you a chance to see the pericardium, which is the covering around the outside of the heart. All right, so your last picture on there is going to show you this echocardiogram and apical view. All right, so this is a apical 4-chamber view of the heart. When they do this one, actually this is kind of nice to go to as well. It takes about 45 minutes to do this ultrasound. You're laying sideways on a, do I have a picture? Yeah, I'm gonna have a picture. You're laying sideways in a dark room. It's nice and warm because, you know, the equipment's all warm and it's quite relaxing. They're kind of giving you a side massage. So the important thing here though is to look at the orientation of the heart. Alrighty, so it's going to kind of look a little bit different than, you know, we show you a picture of the heart and tell you this is what the heart looks like. This is because we're going to be taking this ultrasound from the bottom, so the picture is inverted. So remember, the tip of the heart is called the apex. This is the left ventricle, and you can kind of tell because it's bigger than that right ventricle. All right, this is the one that's got to pump all the blood to the whole entire body. Okay, this is your right ventricle. This is your left atrium, and this is your right atrium. Okay, so it's giving you a pretty good view here. Now, if this was running, like on this video here, it shows you the, oh, actually, I'll link it in the lesson. They'll show you the little flaps opening and closing. I took a video of my own, but it was just so darn cute. My little heart was beating, and the little flaps are opening and closing, and I was like, I'm going to take care of you forever, I swear. Anyway, so this is what it looks like when you're getting it done here. Okay, this is the mitral valve in here, and here's your tricuspid valve in here. So you're getting this to, again, it doesn't quite look like this. You're in a darkened room. And I know when I had the technician was on this side, and then the screen was up here, so you could kind of watch it as well. But they're doing the ultrasound up through the bottom. So again, here's the skin on this part here, and then you're looking up through the heart, through the middle. Okay, so I think that might be the end of today. This last one though, yeah, this is the last slide. So this last slide here, again, look, we've got the name up here, we've got the date, okay, showing you this an echocardiogram. This is called a Doppler one. So what they can do as well with this is they colorize it, and having it colorized helps you, well, there's two things. Using a Doppler ultrasound shows you how fast the blood is flowing, so you can see it through like the aorta or any of the other arteries you want to look through as well. But this was kind of neat here because this is going to show you what blood is going forwards and what blood is going backwards, because you know the blood should all be going forwards through the heart. So this is showing you here that there's a little regurgitated jet of blood that's coming back down through the aortic valve. Through the aortic valve, all right? So it should be all jetting through there, but there's something wrong with that valve, and the blood is coming back through rather than all shooting out, okay? So the Doppler ultrasound, they colorize it, and it helps you see how well how fast the blood is flowing, and it's also giving a little bit of an idea if there's any flow back, all right? So there will be an assignment with this. Again, just do your best on it. That's all you have to work on for tomorrow is that assignment. That'll be the job for tomorrow, but I will post it for today. So if you want to get it done over with, you can. Do the quiz on this one. So you'll have a day to do quizzes, work on your other work, whatever it is that you need to do. Alrighty? I think that's it for now. Talk to you later. Bye.